Hi, welcome to this week's Nurse Coach Duo. This week we have Dr. Yvonne Karney. She's a functional medicine physician in the Chicago suburbs and founder of Vitality Renewal Functional Medicine. Dr. Karney specializes in midlife wellness, which makes her a perfect fit for the Nurse Coach Duo. Known as a hormone locksmith, Dr. Karney teaches that inflammation damages the receptors that hormones need in order to do their job. She has particular expertise with women showing positive ANA or anti-nuclear antibody. A positive ANA is a red flag that shows that the patient is caught between immune dysfunction and autoimmune disease. Using bioidentical hormones, gut healing, and detoxification, she helps her patients reverse immune dysfunction and reclaim their energy and focus their life to live their purpose. This is an amazing interview. You'll love all of the information that you get. Even if you're not interested in autoimmune, you'll be shocked at how much information you walk away from that you can use in your day-to-day life just to be healthy. So hope you enjoy this episode. Don't forget to subscribe. And if you like it, please leave a comment. Before we dive in, just a quick reminder. This episode is for educational purposes only and isn't medical advice. If you're dealing with a health issue, please check in with your healthcare provider.
Hi, welcome to the Nurse Coach Duo. My name is Angie McGuire, and I am the owner of Coach Angie.
And hi, I'm Jen Schroer, the owner of Clarity Health and Wellness. Apparently, I don't know my own company today. And today we have Dr. Karney on. Welcome, Dr. Karney.
It's so good to be here with you.
Oh, we're so excited to have you. So, Dr. Karney has as you heard in the intro, has a plethora of information she could be sharing with us. But today we're going to talk a lot about autoimmune and immune dysregulation and kind of what that picture looks like and her viewpoints on that. But as you can see on her name here, she calls herself the Hormone Locksmith, which I think is awesome. So I want to just have you tell us a little bit about that, what that means to you, how you kind of help people unlock their hormones.
Yeah. Well, thank you for the opportunity to share that. I am a gynecologist originally by training. I've been in practice, oh my goodness, 30 years. But in the course of trying to help women, I realized that it's just so much more than hormones. I think hormones are so important, and we could have a whole discussion about how hormone replacement therapy got messed up over the last 20 years and how women do deserve to have optimized hormones. And so that's a big part of what I do is help women optimize their health with hormones. But hormones work when they have receptors only. The purpose of the hormone is to trigger a response. And I have met so many people who had worked with someone who did, bioidentical hormone therapy, but they didn't look at the whole picture. And it's kind of like if you have a key and a lock, the hormone is the key, but the receptor is the lock. And if you have good keys but rusty locks, the system doesn't work. And so we really need to look at lifestyle, detoxification, self-care, optimizing micronutrients, because the cell has to be able to respond to the hormone. First, you need to have the hormone be able to fit into the receptor to try to trigger the response. And then you need a cell that has the energy and the capacity to respond to that little message that it just got. Otherwise, it doesn't work. So
Yes.
what we do is we look at all of those things. We look at micronutrients, we look at stress, we look at environmental toxic exposures. We optimize hormone levels. There's a huge difference between normal range and optimum. And so if somebody comes and they say, well, my regular doctor, because I used to hear this over and over as a gynecologist, my regular doctor told me that my labs are normal, but I don't feel good. So please help me. It must be my hormones. And so over time, I was like, well, what did they call normal? And then I started learning the difference between normal range and optimum. So sometimes the reason people people don't feel well when their doctor tells them their labs are normal is because they didn't either check the right labs or they're not looking at the right range. But sometimes maybe the levels are okay, but it's that the cell can't respond because it's so toxic that it can't respond to those optimal levels.
Yeah. I mean, it's so interesting. It's so, there's a lot of questions I would like to ask from what you've just said. But
that was a mouthful. Sorry.
Yeah, no. It's so amazing. You can just feel your passion to support, educate, and get to people to their optimal level of wellness, right, and health, and to ultimately feel better, right? But it can be very confusing, right? It can be, I mean, every time I've talked to you, Dr. Carney, I feel like I learned something, and I have a little bit more knowledge maybe than the average, you know, woman, like going into perimenopause and menopause. But let's like just back up when we talk about like talk about the immune system and immune system deregulation versus autoimmunity. Can you talk a little bit about the difference, and or like when someone comes into your office, do you talk to them about these two things?
Yes, absolutely. And this is a big passion of mine because it's completely missed in the traditional
Yeah.
setting, 100% ignored. And it breaks my heart.
Mm.
We screen women for, we take, people come in and they get their blood pressure checked, they get their weight checked. Usually they get a blood sugar. So we identify this thing called pre-diabetes, right? When you have abnormal blood sugar regulation, and people are now told, oh, pre-diabetes has health risks. Let's try to get your blood sugar under control before you develop overt diabetes. But nobody looks at the immune system and says, oh my gosh, you got some immune system dysregulation, which is a risk factor for autoimmunity and cancer and funky stealth infections with like abnormal responses to viruses that we just lived through.
Yeah.
People who had the strongest immune system didn't have the abnormal, the prolonged COVID or long COVID and autoimmunity. And so the difference between, and so nobody even really talks about immune dysregulation. I think that might be a term that I kind of just use a lot, but
Yeah.
a lot of people are like, well, what does that mean? It means that you have an immune system that's not working right, but it hasn't developed into overt diagnosable disease. See, autoimmunity is a disease, and it's identified by a name that corresponds to the organ which is the most affected. So if it's your gut that is the most affected, then it's Crohn's disease or ulcerative colitis. If it's your joints, it's rheumatoid arthritis. If it's your blood vessels and soft tissue, it's lupus. If it's your brain, it's multiple sclerosis or ALS. And then if it's your thyroid, it's Hashimoto's or Graves' disease. But nobody identifies. So over and over, like once I started doing this true wellness and helping women and looking very thoroughly at all their markers, and I started testing this blood marker called an anti-nuclear antibody, ANA, and I found some that were positive in people that were told that they were healthy. It's like, well, what is going on with this? And traditional medicine acknowledges that an ANA will be positive about 10 years before the development of frank autoimmunity.
Wow.
But it's not screened in the traditional medicine, wellness exam. And so a typical person who would get an ANA done is the woman who's going back to the doctor multiple times. I'm tired. I can't think straight. I don't feel good. I'm not sleeping right. I have aches and pains. And guess what they're told the first time they say that? Oh, well, you're 45 or you're 50 or you're whatever, and that's just normal aging. But then a lot of people accept that and they never go back again. Or they go see a different doctor, or they go to their gynecologist and say, help me, it must be my hormones. Because that's how they ended up in my office. Or if they keep being persistent, then eventually the primary care doctor will say, okay, well, let's run some extra tests. So you're tired. We'll run an iron level or a ferritin and a blood count, and we'll make sure you don't have autoimmune disease. So they check the ANA, and oh my God, the ANA came back positive. You need to go see a rheumatologist. Okay, so then these women are sent to the rheumatologist, and rheumatologists are some of the smartest people I know, but most of them are super traditional in their thinking, right? And so they said that they're told by the rheumatologist, they go through these questions of what symptoms do you have and all this, and then they're told, well, you don't have an autoimmune disease yet. Yeah, something's not quite right, but there's nothing I can really do for you. So come back when you're worse, and then I'll give you immune suppressing medicines or steroids. and they're not told to do anything different in their life. So basically, they're on this train track headed for disaster, and they're not told how to get off.
Yeah.
And there's so much that we can do to take control of that. And so then once they develop autoimmunity, now they have end organ damage, liver, joints, gut, and they're very far off. And then the treatment is these biologics, which are immune suppressing medications. And the side effect of these immune suppressing medications is abnormal stealth infections like TB, reactivation of viruses, and cancer, because it's not balancing the immune system, it's just suppressing it. So if you picture a teeter-totter, a balanced immune system that is capable of fighting viruses and bacteria and cancer, but doesn't attack body parts, that's what we want. God made your immune system to fight viruses, bacteria, and cancer, but not to attack us. So if it's working right, it's balanced. And on this side of the teeter-totter is cell-mediated immunity, where we make antibodies, like antibodies to strep and things like that. And on this side of the teeter-totter is cell-mediated immunity. And that is what is good for intracellular bacteria, viruses, and cancer. And so if anybody knows when one side goes up or down, it affects each other. So when something is suppressing cell-mediated immunity, now we have this high antibody-mediated immunity. And the offshoot of prolonged high antibody-mediated immunity, if it goes uncontrolled, is autoimmunity. And then if we have this, then the low cell-mediated immunity puts us at risk for stealth infections like tuberculosis, long COVID, Lyme disease that's hard to treat, reactivation of HPV and shingles and chronic fatigue syndrome by the CMV. All those things are affected with a low cell-mediated immunity. And so what these biologics do is they raise or lower the platform. They do not balance. So if you think about these commercials that you see for Crohn's disease, and that person with Crohn's disease has high antibody-mediated immunity already and low cell, and they say, we're going to make your Crohn's disease better by giving you this biologic, but guess what? Talk to your doctor, because if you've had a vaccine or you've had tuberculosis or one of the risks is cancer, and it's because they're taking this unbalanced teeter-totter and they're dropping the floor on it. So it brings this below the symptom level, but in the process, you have zero cell-mediated immunity. And then the reverse is true. Those commercials that you see for small cell lung cancer or breast cancer, that they say, you have this cancer and we have a biologic that can help you live longer. That is awesome, but it doesn't balance it. It just raises it. So that's why the side effect of those medicines are like bloody diarrhea, inflammatory bowel disease, autoimmunity, because they're taking an already imbalanced immune system, and instead of balancing it, they're raising the whole thing.
Yeah.
And it's like, let's get back to basics. Let's figure out how to balance it before it turns into those things. And it's just such a passion of mine, because 80% of autoimmune disease is in women. That's astronomical. And how long have these women been suffering with fatigue, brain fog, aches and pains, and told it's normal? It's just stress. Well, stress has a huge part for sure, but it's normal for your age, before they finally get tested and diagnosed. And so sometimes when I'm doing an intake on a new patient and we're talking about an ANA, and I bring up that their ANA is positive after I've done some labs, they go, oh my gosh, it was positive 5 years ago. And I went, and my doctor did send me to the rheumatologist. I forgot about that, but he said, don't worry about it, come back later. And now they're worse.
Yeah.
It's a travesty to me. And I'm on a mission to stop it.
Well, thank goodness, because someone needs to
Yeah.
be on a mission to stop it. I mean, like you said, you're looking at 80% of the people with autoimmune are women, right? It's
Mhm.
predominantly diagnosed in the 40s and 50s, that whole perimenopause, menopause, right? We're
Mhm.
dealing with providers, and I hear this kind of a story all the time of saying, well, come back to me when you're sick. And it's like, wait, this is a really beautiful time frame where we can try to balance this out and manage this. And as you're saying, like for one, autoimmune or it affects so many different things. So it's not like you can say, I have this one symptom, oh, it must be autoimmune. Like there's so many symptoms, right? And the
Yeah.
treatment is not as simple as giving a drug, which really how many disease processes are there that is that simple, but that's how we are kind of the bill of goods that we're sold, right? Like
Amen.
that's not root cause treatment. Very little of what we do is root cause unless we're seeing someone like you, someone functional med.
They're
um
not trained that way. And
right.
I think the doctors mean well. I know that I mean, I was a very traditional gynecologist for years. I was an Air Force doctor. I was in the military. I was like, yes, ma'am, no, ma'am. Follow the algorithms. Don't think outside the box. Do what you're told. And then
Yeah.
at some point it was like, this is not working.
Right.
It's
Yeah.
not working.
Agreed. And I think that, when you talk to like people like us, Angie and I, and like people who are kind of in this realm of more of lifestyle medicine, talking about lifestyle management, that type of thing, you're finding more people who, yes, were in that traditional space at one point and are like,
Yeah.
wait a second, how come I just did what I was told? I can actually like think with my own brain. This is amazing. So
Mhm.
one thing, Angie and I have talked about in the past is uh, uh insulin resistance, right? And like we've talked about the fasting insulin and how that predicts earlier. So now I'm hearing the kind of the same thing. ANA predicts earlier. So
Mhm.
should, people frequently say, what labs should I ask for when I go in? Are you thinking, and would you recommend that like an ANA is something that we should start looking at as part of our well woman exam?
I do. Periodically, absolutely. But see, if you're given a 15-minute appointment with a doctor and you're supposed to get your breast exam, your pap smear or whatever, they don't have time.
Right.
And but yes, you should demand the test. And then if it's positive, that's a red flag. Huge red flag. You are headed for disaster. Get help and learn how to support health. I mean, one of my favorite sayings is from Mark Hyman: when we create health, disease disappears as a side effect. So let's create health. And it that happens outside of your doctor's office. That does not happen in the 15-minute appointment.
Right.
And so, but also looking at like optimum versus normal range. I used to be able to go through 10 pages of labs in 45 seconds or less because I would just look at,
Yes.
if it's high or low, it's bold. And so I would quickly flip through the pages. And if I didn't see anything that was high or low, I didn't even look at the value. That's not the way I was trained. I'd be like, your labs are normal. But now that I know that normal range is a statistical equation that just occupies 90% of the population, I don't want to be like 90% of the population. I don't think 90% of the population is healthy. So now I
Exactly.
take a deep dive and I look at like what's optimum versus normal, and it's much narrower than 90% of the population. It may be in the middle, it may be at one end, or it may be at the other end, but I think we can all agree it's not this wide, that's 90% of the population. And so, yeah, I mean, hopefully, doctors are under a lot of pressure if they're like in an HMO about what kind of labs they can order and they get dinged. I remember getting dinged as a doctor for ordering too many expensive labs on my patients. And
Mm.
so you don't get to get, you get these pay scales that are different depending on whether you're a good doctor or you're one of those wasteful, expensive doctors. And so that's one of the reasons why, I don't take insurance in my practice because I don't want to be constrained by that. I want to practice the way I think the person needs it, and we're going to do what's right for them. And I'm not going to be constrained by time, and I'm not going to be constrained by an insurance company. But hopefully the doctor would order an ANA if you ask for it. But if not, there's places you can go to get tests run on yourself, right? Any lab tests now, or come see a functional medicine doctor that's much more in tune to those types of tests.
I think Jen and I would both agree that we get asked a lot of like where to go, right? Like where,
Yeah.
when you're talking about this and, when we work with our clients, we're not only, I think part of what we're trying to do is, teach them, empower them to advocate for themselves, right? But still the
Mhm.
system doesn't always support that. So even if
No.
someone goes in and says, I want an ANA, there's going to be it gets confusing, right? I mean, I think for a lot of people, but I love that we're having this discussion to make, I mean,
Knowledge is power, right?
knowledge is power. I mean,
You guys
I'm
are helping
empowered from this
women
discussion
navigate.
already.
Yeah, maybe you guys are helping women navigate the traditional system so they know what to go and ask their regular doctor
Yeah.
for.
Yeah.
And then if they get the answers that they need, that's great.
Yeah.
But if something comes up and something is identified that you're like, okay, well, wait a minute, you're telling me that's normal, but that's not what I heard, and I sure don't feel good, then you got to look outside the box. And that's what I'm here for. You know what I mean?
Yeah. But do you think that it's going to become more in the box? Like as our system is, I mean, have you seen it change over
I got out of traditional medicine because I couldn't wait for the change. I don't think so, honestly. It's
Yeah.
getting more and more regulated, and now doctors that speak their mind are considered at risk of losing their medical license for spreading disinformation. Excuse me, but what the F is disinformation, right? That's a subjective term that means somebody that's in power disagrees with it. And if doctors were not, if we were not willing to change our mind in medicine, we'd still be bleeding people with a fever. But now all of a sudden nowadays, it's like if you say something that they don't think is right, it's a little scary out there. You can be at risk because somebody can say, oh, that's disinformation. And now, medical boards can look at you. The College of OBGYNs came out with a statement that if you spread disinformation, you might not be able to be board certified as an OBGYN anymore. And who determines what is disinformation?
Right.
I don't.
Yeah.
It's taking the power away from the patient, right? I don't think we should just tell people what to do. I think we should have an honest conversation about risks, benefits, and alternatives and let them decide. But in order to do that, you have to be willing to learn what the risks and benefits and alternatives are. And if you're just following an algorithm because all you have is 10 or 15 minutes with the patient, there's no risks and benefits in there. It's do this, if then do that, if this, do that, and it probably works for 25 to 50% of the population. Do fine with that approach, right? But then eventually it stops working, and that's when you get all these medicines prescribed to ease symptoms. And I think that the traditional provider really wants to help, but the tools that they're given is either cut it out with surgery or suppress it with some medication, not the fact that we believe the body can heal if we give it the right things. Take away the cogs in the wheel and give it what it needs to heal, and then get the hell out of the way.
Yeah. I mean, truth is, right, we're getting more unhealthy, right?
Oh, for sure.
As a nation, we have so many hospitals, so many gyms, so many avenues to be healthy, but somehow we're more unhealthy. And it's not just, I mean, it's a very, very large percent of our lifestyle, obviously, but it's also just because we're not thinking outside of the box. We're not allowing ourselves to say, okay, yes, our bodies should be able to heal us, but we are insulting it every day. Our environment is insulting it. What we're putting into it is insulting it. So we have to be able to look at it a different way than just the traditional, like you're saying, like cut it out, put a drug on it, what have you. So, and it's, like you say, our bodies know what they're doing. We're creating more issues with the stuff that we're in our environments and stuff. But tell me a little bit about what your thought process is for women of, perimenopausal, menopausal age group, right? Our bodies are changing.
Yeah.
We can't do anything about it, right? Our ovaries are going to age out. We're not here trying to keep ovulating for the rest of our lives. This is normal. But what is it causing in our immune system that we have such a higher rate of autoimmunity in women than we do in men? I feel like it's got to have something related to
That is such a good
aging out.
question. And I don't think that there's anybody that knows the answer for sure, but I can certainly address that from my experience and my opinion. And I actually think that perimenopause and menopause is a perfect storm, right? Because as women, we are wired as caregivers. So we put ourselves last for decades, taking care of everybody else. And so, and then in midlife, what happens? Our parents are aging or they're dying, right? If we're lucky enough to have aging parents, there's a role reversal, and now we're giving care to them instead of vice versa. That is not easy. Our kids are leaving home. And then we're looking at the relationship we have with our spouse. Like, oh my gosh, we're empty nesters. Do I still like my husband? Do I know my husband? If it, a lot of marriages don't survive that. And then you're out in the single world again. And then you have on top of that, a total toxic load, right? We have so many toxins that we're exposed to. And what happens is there's a little bit of this and a little bit of that and a little bit of this and a little bit of that. And none of them may be high enough to alert the Centers for Disease Control or the Environmental Protection Agency that you have a toxic burden, because the EPA says, for instance, lead at less than 5 parts per billion is not toxic. Okay, but what if you have a little bit of lead and a little bit of mercury, and then you put aluminum on top of it, and then you have these chemicals, and then you have a mold exposure? Poof.
Yeah.
And so we have that accumulation, and then we have our hormone shifts. And the hormone shifts, right now we're not sleeping well because we're flipping having hot flashes every night. And if you're not sleeping well, your cortisol goes up. And if your cortisol goes up, your immune system is suppressed and it leads to inflammation. And when your hormones drop, now you do get some insulin resistance. There's a metabolic dysregulation that happens, and it ends up being about 70 kilocalories a day or something like that, which means that it ends up being about 1 to 2 pounds a year that you gain if you do nothing else. Well, you add that up over 5 to 10 years, and now you're 20 pounds, 20 to 30 pounds heavier. And that inflammation leads to immune system problems. So it is a
Big circle.
web. It's not just one thing.
Oh, yeah.
It is a web, but we have to break the cycle. So where do we break the cycle? Well, maybe with hormones so that you can sleep, right? Start with sleep. Then we look at, decreasing toxic exposure, self-care, put yourself higher on the totem pole. You do not deserve to be last anymore. It's your time. But it's so many things. It's like, you can tell I'm passionate about it, but it's not just one thing, it's everything. And that's why for people who are like, okay, don't tell me I need to eat different. Don't tell me I need to, I don't have time to meditate. I don't have time for stress reduction, but I want hormones.
Right.
I'm like, okay, well, here's your keys, but you got rusty locks. Good luck. So we got to look at the whole thing.
So what are some practical steps or like for midlife women, to protect their immune health? I mean, I think we've already talked a little bit about this, but like when someone comes to see you first, if they were, they have the symptoms, what are some practical steps to take versus just only hormones? I mean, you mentioned
right. Yeah. No, hormones are not
just
for everyone,
a little bit on that.
That the conversation is for everyone, but the hormones are not for everyone. So I want to be clear on that. It's everyone deserves a conversation, but it's the provider and the patient with looking at personal situation, all that matters. And basically stabilizing the immune system is it's a simple concept. It needs to be individualized, right? But we give the body what it needs: micronutrients, macronutrients, protein, healthy fat, sleep. And then we take away the cogs in the wheel: trauma, stress, inflammation, toxins, stealth infections. And so you have to do the evaluation on the person to see what does the body need that it doesn't have, what's missing. And then you do the evaluation to say, what do I think their toxic load is? Do they have a history of trauma? Do they have super high stress that is locking their nervous system in the fight or flight mode? Because if your system is locked in the fight or flight mode, you can't heal. Healing happens in the relaxation nervous system called the parasympathetic nervous system. And if you're living your life 24/7 in the sympathetic mode, thinking that a tiger's chasing you, you're at risk for disease because you can't heal. So you either get sick because of a massive exposure or because you have little buildup of exposures and you can't heal. And most people are the latter, right? Most people get sick because they keep piling thing after thing after thing on top, and they never figure out how to get that margin of resiliency. The margin of resiliency gets smaller and smaller the more things you start piling up. And then when you lose it, you get sick. So we just need to figure that out.
Easy peasy. Just figure that out.
But there are some practical steps people can take, right? So number one, reduce your stress. We don't need to learn to manage our stress. We need to reduce our stress. And how do we do that? Well, learn to say no. God gave you a voice for a reason. Women are not very good at saying no. We feel like if we say no, we're letting people down, right? And so that's one of the things, I mean, I spend time on that with my patients. Let's figure out how to say no. You can say, I'd love to, but instead of no. I wish I could.
Yeah.
Maybe next time. And that's a very polite way, but you have to stick up for yourself. And then, the deep breathing, those things are so easy. We call that the box breathing. You take a deep breath in until your diaphragm stretches. You hold it while you're counting to like 4 or 5. Then you exhale slowly and then you wait again. And then if you do that, like I tell people when you're driving, every time you're stopped at a traffic light, do the box breathing. Okay. If you're watching TV during the commercials, do the box breathing. Because that triggers the vagus nerve and stimulates the relaxation nervous system, and that helps you reduce your stress. We need some easy things to do that, because telling someone to meditate if they don't know how is not going to help. Yeah, and not having unrealistic expectations. Just, have compassion on yourself. We talk to ourselves so much worse than we would ever talk to anyone else.
Yeah. And what I'm hearing is like self-care, like, everybody talks about, oh, self-care and how it's not selfish and it's not that it's literally self-preservation. And like we are looking at, and it's not just breathing, it's exercise, it's nutrition, it's all the things you're talking about, right? It's all the cogs in the wheel. I like that analogy, like there's so much to it that but it doesn't have to be difficult, right? And that's part of like some of the coaching that Angie and I do is just really let's make it doable, right? Like let's fit it in your day. I'm not trying to rearrange your whole day. I'm trying to say, what do you do today? What's a normal day look like you? Okay, let's stand for that meeting.
One
Let's
little
walk for
tweak.
that meeting. It doesn't have to be huge. It can just be small things that fit into your life. But
sustainable baby steps in the right direction will get you to your destination.
Yeah. And I'm here, I hear a lot of really great, recommendations within this. And like, okay, if you come in, you're not feeling well, we see you have a positive ANA, these are some things you can do. I guess it's for those people, but also for the people who are already diagnosed. I'm full blown, I'm in it. I've got 3 or 4 already, because like it seems to be you get one, you get more. Like
absolutely, because nobody ever treats the underlying root cause. They just suppress it.
And right. And so in your thought process and the way that you manage things, are you saying that we could actually reverse this, that we can turn this around?
Absolutely. I've seen it. I've seen it.
So
over and over.
So the PSA here is that like just because you have it doesn't mean that you have to live with it. Just like diabetes, just like high blood pressure, just like all of these things that people are like, this is a lifelong disease that you're going to have. Like you might have lifelong management of it, but you can reverse it.
I've seen it reverse. I never make promises, but what I do is I do a deep dive evaluation as to what I think the triggers were. And so many people blame the last event. I was fine until blank, and then all of a sudden I got sick. But usually it's a whole layer of things underneath it. And then that was just the most recent.
Yeah.
And so, we do the evaluation to see what the triggers are, and then we start reversing the triggers. If we address and reverse the inflammatory responses, if there's heavy metals, if there's glyphosate, is there mold, is there chemical toxic exposures? Are they not sleeping because they have Wi-Fi exposure at night and we need to, adjust those things? Do they have a history of trauma? And all they've done is talk therapy, but not the healing of the subconscious brain. So there's so many things, but what I tell people is findings are good news, right? So people come to see me, they have a lot of things going on. They don't feel good. Some of them have frank autoimmunity. And it's like, okay, we're going to do this evaluation. Guess what we found? We found like 6 things that are major contributors to autoimmunity. Now we're going to start whittling away at those things while we optimize your micronutrients, eat right, maybe give hormones if there's if there's a hormone deficiency, and I'm talking about all hormones, and then we evaluate to see what happens. And I've seen it reverse. I can't promise it will, but
Right.
I've seen it in people that adhere. Um, so it's just don't take no for an answer and find that help. We have to be willing. We have to, number one, realize that we're in control of our health and not someone else, and that it's okay to ask questions. And if the doctor doesn't want to answer your questions, then you have the wrong doctor. Period.
Period.
Right. I often say too is, if you ask questions and there's not the answer on that day in that 12-minute visit, make the earliest appointment again, right? Or
Mm-hmm.
find a new doctor. But like
Mm-hmm.
we're trained also to like have an annual exam or like, you
Once
know,
a year is not enough to stay healthy. Like once we get someone healthy, it takes a lot of work to stay healthy. And if we wait
right,
until we have symptoms
right.
to
Well,
go
we're
see the
trained,
doctor
yeah,
again, we're way behind the eight ball at that point.
Yeah.
right.
So, you need to, I call it like when I work with people initially, it's like, okay, we got to get you healthy. All right. And then
Mhm,
we start practicing what I call the longevity medicine. How do we keep you there for as long as possible now? Because none
mhm.
of us are getting out of this world alive, right?
Yeah.
But we want to stay and maintain health until
Mhm.
the very end and then go down a sharp cliff, not this like slow, painful decline where
Right.
we are living under the support of other people because we can't, take care of ourselves anymore. And in midlife, it's like, women are really struggling. And, now that, with all those other things, hopefully now they're starting to have grandkids and they want to be able to have energy. And maybe now they're finally able to retire. Their husband is retired, but they don't have any energy and they feel like crap all the time. So they can't enjoy the life that they've worked so hard, that they put on hold for so long, taking care of everyone else. Right. And now they finally get to the place where they should be able to enjoy it, but they can't because either they have some illness, or they just don't have the energy and they're told, well, yeah, but you're older. That's what it's like when you're older.
So, what's one piece of advice that you would say to women in midlife to start with?
Yeah. Number one, if you feel like something's wrong, it probably is, right? If you feel like something's wrong and you talk to your doctor about it and they say that's normal aging, that's go somewhere else.
Yeah.
We deserve, I really believe this with my whole heart. We deserve energy, clarity, and stable moods.
Yeah.
Menopause is not a personality change. Right? So many women are like, I don't feel like myself anymore. I fly off the handle. Is that just what it's like? No, it's because you don't feel good and you don't have energy and you're drowning. If you think of a person who's drowning, because I used to be like a lifeguard. And when we were doing the lifeguard training, they were like, if you go to try to save a drowning person, they're going to drown you unless you get them under control because they're flailing. Right. And so if you're flailing and you're barely able to keep your head above water, because you're so stressed and you're so tired and you feel like you're losing it, you're fine as long as everything goes along okay during the day, but you hit a speed bump and you lose it, right? That's not because you're a bad person. It's because your body's not working right and you don't feel good. So you're lashing out because you're drowning.
Yeah. It's
And
just like you
that's
were saying before, it's that last layer, right? That last straw. It's not that you're this horrible person. And it's just that it's stacked, it's stacked, it's stacked. And you've hit your threshold and you've held your S together for all the
so
all day
long and you
long.
can't. I mean, it scared me because I mean, as an OBGYN back, the last couple years of my practice, I quit delivering babies because it was just so it's a very difficult lifestyle. But, I was delivering babies when my kids were little and I was flailing because I was so tired all the time. And I was like, didn't like who I was becoming. I didn't have patience. I wasn't the mother, the wife, the friend, the colleague, anything that I wanted to be because I was so tired all the time. Now, the reason I was tired was because I wasn't sleeping at night because the hospital was calling all the time. But it doesn't matter what's making you tired. Some people are tired because their mitochondria are broken and they can't make energy because they have too many toxins. It's the same. You're tired, you can't think straight, your energy is low, you feel like you're drowning all the time.
Yeah. Yeah, I work with clients a lot on just body awareness and like how they feel. And I
Mhm,
feel like that's the
mhm.
overarching message here, right? Like if you
Mhm.
don't feel like yourself, if you don't feel, if fine is the highest level you can get to in a day,
Right.
you deserve to feel better than fine. You know what I mean? Like, and just keep pushing. You know, we're not all lucky enough to have Dr. Karney in our available to us. I don't know, Dr. Karney, if you have other advice on if people are looking for someone like you, don't live in Illinois, you may work outside of Illinois, I'm not sure, but do you have any advice for how they can find somebody like you to help them?
IFM.org is a great resource, and they will, you can do it, find a doctor, and then I believe it's A4M, A number 4M. I don't know if it's .com or .org, but they have lists of providers who have trained through them. Um, I right now do not work with people, and my license is in Illinois, so I do have people come and see me from out of state, and establish the doctor-patient relationship, and then we can follow up virtually. The way the rules are is that you have to come back periodically, which right now periodically is an undisclosed amount of time. We don't know what that is, but you have to come back periodically to reestablish the doctor-patient relationship. But I do have
That's
people
good to
that
know.
do that.
Yeah.
But yeah, it's definitely you got to look. You got to look somewhere, right?
Yep.
Yeah.
Yeah.
We'll put those links in the descriptions that you mentioned too, just so,
Sure.
and of course your information too. So how do people in Illinois find your, like, how would we establish a patient relationship with you? What's the first step?
Yeah, well, we do discovery calls to make sure that it's the right fit. And right now, I'm encouraging people to call my office and get a discovery call by calling the office. And then we get people in for what we call a deep dive wellness assessment, which is a
Mm.
very thorough 2-part appointment where we do a history and then we determine the appropriate labs based on our assessment. And then we do a review of findings and make a recommendation for long-term care after that. Like what kind of program does someone need in order to reach their health goals? And it depends on, the findings, how significant their issues are. I have a team, so I have 2 nurse practitioners that work with me, and it's a fabulous team. And so we just encourage people get help, get
Yeah.
the answers. And when people come in for our deep dive wellness, it doesn't necessarily mean they're going to become a patient in the practice. Some people just want that assessment and then they might take it somewhere else. But most people stay because once they
Mm.
see what their issues are, so much more than the four blood tests that your regular doctor will order on you.
Mhm.
And then we look at them through the lens of optimum instead of normal range. It's really powerful to have that evaluation. It's kind of like I call it, you are here on the Google Maps of health, right? So we need to know where you're starting
Yeah.
from, because if you don't know where you're starting from, you can't get directions.
Right. That's a great analogy.
Yes.
Well, I gotta say, I mean, I just feel like this whole episode has been super, like, just empowering. Even if it's
Yeah.
not an autoimmune thing that someone's struggling with, I think they got the message of you can feel better, and there are people who are out there to help you. But I really love just the extra layer of knowledge of knowing how to one ask for what you need, like the test that you need, and then also two, all the advice that you gave as far as how to either reverse or prevent getting an autoimmune is kind of advice just in general in life, how we're
Mhm.
going to be healthy, right? Like, so like,
Absolutely.
regardless of whether this was you came to this for autoimmune or not, you got a ton of great information. So I
Yeah.
really appreciate Dr. Carney for all your time. I know we have plans to have you back in the future because we have many more things we want to talk to you about. If you like this episode, please hit the like button, subscribe, add comments, and then we also have a session, or sorry, an episode that's upcoming about gut health, which is where your immunity is. So that's a really great little
Absolutely.
combination of
Yeah.
episodes there that you can watch the two of them together and get a lot of great info. So thank you again, and please subscribe, and we will see you next time.